Hey guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we are going to be talking about esophageal strictures. Today is Christmas. Merry Christmas to you guys. I hope you guys are having an amazing day with your family, and I hope you guys are having quality time with your family. Now, before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions or concerns, please contact your primary care physician or physician assistant. What are esophageal strictures? Esophageal strictures are the most common cause of dysphagia in the population. What is dysphagia? Dysphagia is trouble swallowing. Esophageal strictures include esophageal web, esophageal ring, like a Schatzky ring, and esophageal diverticula. In this video, we're only going to focus on esophageal web. On the next video, esophageal rings, and on the video after that is going to be esophageal diverticula. What are esophageal webs? Well, this is the best way to imagine. An esophageal web, you have the esophagus, which is a pipe, and then you have tiny growth of like a web like this, like between your fingers. You have like a tiny growth in your esophagus that causes interruption, or the patient experiences symptoms of dysphagia because the food tends to slow down at that area. Therefore, the food tends to get stuck a little bit and then eventually goes down. Now, the patient only has the symptoms with solids, no liquids. They're fine drinking the liquids. Usually the patient will present to the clinic and they will tell you, well, when I'm eating bread in the morning, chicken breast, rice, I feel like the food tends to get stuck in the esophagus, but if I drink plenty of fluids, then the symptoms go away. They don't experience nausea, vomiting, or anything like that. Cervical esophageal webs are more commonly found in females, and it is associated with iron deficiency anemia. How are you going to diagnose an esophageal web? The best test is to obtain an esophagram with a tablet. An esophagram is a picture of the esophagus. The patient usually drinks a barium liquid. It takes a picture of the esophagus, and then the barium tablet will show where the issue is at, because the tablet tends to slow down at that web area, at the web. The tablet tends to slow down, therefore the radiologist can tell where the issue is at. How are you going to treat it? Well, if you schedule the patient to have an upper endoscopy, this will usually cure the symptoms or cure the issue. Why? Because when you introduce the EGD, the camera, down the throat, it will rupture that web, and that's it. That's the cure. It ruptures the web, and then the issue is gone. But you have to keep in mind that webs, the cervical esophageal webs, are usually found in females with iron deficiency anemia. And if the patient has iron deficiency, you have to treat the iron deficiency. Also, when the EGD is done, random biopsies will be taken to make sure that the patient does not have eosinophilic esophagitis, EOE. In conclusion, esophageal strictures, in this video only, we spoke about esophageal webs. Esophageal strictures are the most common cause of esophageal dysphagia, which is trouble swallowing. An esophageal web is usually linked to iron deficiency anemia and is most commonly found in females. To diagnose it, you're going to obtain an esophagram with a tablet, and to treat it, you're going to do an EGD, which it will rupture the web that has developed at the esophagus. Now, keep in mind that this is linked to iron deficiency anemia, and if the patient has a history of iron deficiency anemia, you need to treat that as well. If you found this video helpful, click like, subscribe, share the video so I can bring you more videos like this. And most importantly, today is Christmas, and I hope you guys are having an amazing day with your family. All right, I'll see you in the next one. Bye.